Hi guys, this is John Adamson, the Rehab Documentation Guru, and this is part of our Skilled series. I probably should name these the Skilled series because really the number one area that most therapists fall flat in is showing that their skill is necessary. And so we're going to examine this PT skilled statement. We're going to see, is this truly skilled or not, based on the formula that you've seen in other videos of mine about skilled statements, or if you've been to my workshop, Documentation Bootcamp. And anyway, let's examine it together. We're going to read the statement, and then we're going to break it down, and then I'm going to talk about some more generalities of concerns in this particular statement. So here's the statement. Prolonged stretch, passive stretch, left knee extension, and ankle dorsiflexion. Therapeutic exercise to increase muscle strength for bilateral lower extremities, targeting hip flexion, hip extension, hip abduction, knee flexion, knee extension, ankle dorsiflexion, and ankle plantar flexion, 2 sets times 15 reps at a resistance level of 3 pounds, right, I'm guessing right lower extremity, using weights against gravity in order to enhance functional mobility and decrease fall risk. Now, there are some good things in here, and let's point out what's good. Number one, for a skilled statement, you should be mentioning the CPT or the intervention you're doing. The therapist in this statement clearly states that this is a therapeutic exercise consistent with CPT code 97110, so that's good. They also indicate that they are doing something. There's some action that clearly was mediated by the therapist in here. Not strong action words, and I'm going to talk about the number one there, prolonged, in just a minute. Then we want to look at the target of the action. So therapeutic exercise targets muscle strength, range of motion, cardiopulmonary endurance, and flexibility. So do we see those here? Well, we do see that range of motion was targeted. That's good. We do see that strength was targeted. That's good. And those are the only two targets related to TheraX. But now let's look at anatomical targets. And so we see the target of different muscle groups, different movements that they're working on trying to increase. So we've got targets. That's good. Now let's look at special techniques. And this is where the statement starts to fall apart. So let's look first at that word prolonged. Whenever I see the word prolonged, I often look at the billing to see how long was therapeutic exercise billed for this particular day. And in this case, this patient had a lot of billing that was not justified. And based on what's written here at least, prolonged. Now studies show, and we've known this for a good while, in fact, I just Google searched a couple studies about stretching, and one dated to 1994, which was a proper research study, was done, and they found that 30 seconds of stretch was sufficient to cause increased range of motion or increased flexibility. And they actually determined that there was no significant benefit to going to 60 seconds. So there's a zero-sum gain. Apparently 30 seconds excuse me, seems to be a fairly good length of time for stretching. Now, there are some studies, like for contracture management, that show that patients that have contractures need multiple hours of stretching in a given day, but we wouldn't necessarily build it as skill. We would probably get some kind of device that would put them in a position of stretch and hold them there for prolonged times to get that elasticity, to get that increased range of motion. So just the fact that it's prolonged, to me, is kind of a red flag. It seems to be a justification of something that's not necessarily skilled in nature and might be a misunderstanding on the therapist's part of the true effective time frame you need to stretch for. So that part doesn't look very good. Now let's look at the strengthening. So they worked on exercises to increase strength. They targeted hip flexion. Now a lot of patients can be deficient in hip flexion. Don't get me wrong in this statement, but you've probably heard the old axiom, you stretch that which is tight and you strengthen that which is loose or weak. And in this case, a lot of patients, especially if they're going to be sitting a lot, they tend to be tight in their hip flexors. Not saying that hip flexion strength is not important. In fact, there's good evidence that all hip musculature is important for stability, for gait, for decreasing back pain. So I'm not saying that that's necessarily a bad thing, but it seems like this is just kind of a generic application of strength training across the board, every single area, without really evidence that it's necessary for all these muscle groups. And in fact, when I looked at the documentation, there were not measures in all these areas. So it didn't seem like we needed to work on all of these particular areas. Now, I also know that this is not a proper strength training regimen. I know that because, number one, every single muscle group, they exercise with 3 pounds. And that is clearly not evidence-based. We know that, for example, the hip abductors are going to be significantly weaker than the hip extensors. So are we saying that the hip extensors need the same level of resistance? No. Also, will somebody give symmetrically 2 sets at 15 reps if they're being properly exercised for strength? And the answer again is no. Also, do we know the optimal range for strength training? Well, when you get to 15 reps on a given exercise, you're getting around, and I'm just estimating based on my knowledge in this area, it's going to be around 50% of the patient's 1 rep max. And we're starting to get into a range where even if 3 pounds was a sufficient resistance, which I'm going to argue it probably was not, probably not the best optimal strength training going on. So this is not an evidence of a special technique is what I'm getting at. So looking at all of this statement, for the most part, this looks like it's not really a good application of evidence-based treatment. Also, number 2, this could easily be taught to a non-skilled person within a couple visits and have them execute this, and no longer would therapy be needed to continue this. So it falls apart at special techniques. Now, patient response, that's not really evident here. I've talked about that before. That'll be more evident in how the patient's progressing towards their goals, towards their measurements on their strength and flexibility. That might be in goals as well. And then evolution over time, and really from one note to the next, are we seeing changes going on? So anyway, just in summary, we've got the CPT or intervention, good. We've got some action, obviously caused by the therapist, that's good. We've got targets of the action, that's good. But it falls apart completely at these special techniques that demonstrate the skill and knowledge of a therapist to safely and effectively deliver this care. And that's the problem. So anyway, I hope you appreciated this video. If you like these videos, please hit the like. The more likes I get on my videos, the more traffic that YouTube might cause to come my way, which will help me grow my channel and maybe eventually help with subsidizing my time and effort for putting these together for your sake. So I appreciate that. And if you haven't subscribed yet, please subscribe and tell your friends. This stuff is pertinent regardless of the kind of setting you're working in, and this will be greatly helpful. And of course, for more information about documentation in general, may I encourage you to check out my courses through Summit Professional Education. I've got Documentation Boot Camp, and then I've got 2 smaller courses. They're available online and as live seminars across the United States. I'm actually getting ready to do one up in the New England area in July, within a week and a half actually. And then I also speak for Allied Health Education, and I teach 2 courses currently for them. One is called Documentation Essentials, and the other one is called Neuromuscular Reeducation, which is an evidence-based approach to proving the necessity of that. And I'm coming out with a therapeutic exercise one also this year. So anyway, thanks again. Have a great day, and document to get paid and keep those patients on caseload. Take care.